fatty liver disease, steatosis. It is excessive accumulation of triglycerides within the hepatocytes which interfere and dysfunction the functioning of the active liver. It is of 4 stages: simple accumulation of the fat, second is steatohepatitis, third is fibrosis, and the final or the critical, the most dangerous stage is cirrhosis. At this stage, the disease becomes irreversible. It cannot be cured because the whole of the liver parenchyma is converted into fibrous tissues. The liver is shrunken, shriveled, and stony hard and non-functioning. So there is only option, that is the liver transplant. So this is the critical one. Up to third stage, the disease is reversible and can be cured if it is diagnosed earlier and the treatment started earlier. Now the symptoms of the fatty liver disease. Initially there is pain in the right hypochondrium, nausea, vomiting. As there is progression of the disease passes into the advanced stages. There is loss of appetite, loss of weight, jaundice, anemia, ascites, swollen legs, pruritus, conjunctivitis, malaise, and there is also enlargement of the breast in men, depression, and the anxiety and other neurological symptoms they appears. Now the diagnosis of the disease. History of the patient, physical examination, and then there are the diagnostic procedure, laboratory tests, which are called as liver function tests. ALT, AST, ALP, serum bilirubin, these are the most valuable tests performed in the lab. The blood is taken up from the patient and sent to the laboratory to estimate the evaluation of these enzymes which are elevated in liver damage. Then C-reactive protein also indicate there is inflammation within the body. Its value is also elevated. The most valuable and used is the ultrasonography, abdominal ultrasonography, in which we can visualize the inner texture and the pathology of the liver in more detail. Moreover, high power of sound waves can be used to visualize the pathology, size of the tumor, and the extent of damage to the liver by the fibroscan process, which is also done by the high quality and high power sound waves. Liver biopsy is now rarely performed nowadays. In this, we pass under local anesthesia a syringe into the liver tissue and we extract a small quantity of the tissue of the liver and send to the laboratory for histological study under microscope. By this procedure, we can examine the nature and extent of the disease and the tissue changes in the hepatocytes, whether they are going to be towards the cancer side or they are at the precancerous stage. So these are the various few tests which are performed to detect the pathologies, especially produced by the fatty liver disease.